You've probably heard of therapy and medication for anxiety, cognitive behavioral therapy, SSRIs, maybe even meditation. But what if I told you there are scientists right now who can literally switch off an anxiety circuit in your brain with light? Or that sound waves, yes, focused ultrasound, can calm the emotional centers of your brain without a single pill. Anxiety treatment is not stuck in the past. It's evolving faster than most people realize. My name is Dr. Georgia Brunner. I'm a psychiatrist and psychotherapist based in Switzerland, but also someone who believes psychiatry should go further than just prescribing medication. That's why I created Beyond Psychiatry, to combine the best of evidence-based medicine with psychotherapy, lifestyle, micronutrients, and the most exciting new science that's shaping the future of mental health. And in this video, I want to take you on a full journey through anxiety therapies. First, we'll look at the classic, proven treatments, the ones we already know work, like cognitive behavioral therapy and medication and exercise. Then we'll explore the cutting-edge science that feels almost like science fiction, brain circuits we can map, ultrasound that quiets fear, probiotics that change anxiety pathways, even psychedelics moving into clinical trials. And finally, I show you what you can already do today to calm your nervous system, practical tools that anyone can start with right now. So whether you're struggling with anxiety yourself, supporting someone who is, or simply curious about where mental health treatment is heading, this video will give you both clarity and hope. Let's start with what we know works today. Psychotherapy, the gold standard for anxiety, is still cognitive behavioral therapy, or CBT. Multiple meta-analyses have shown CBT is effective with moderate to large effect sizes across anxiety disorders. What's powerful about CBT is that it doesn't just mask symptoms. It teaches you how to identify catastrophic thoughts and gradually face avoided situations. There's also acceptance and commitment therapy. A recent systematic review found ACT effective across age groups, teaching patients to live alongside anxious feelings without being controlled by them. Exercise, movement is medicine. A 2023 meta-analysis showed physical activity reduces anxiety symptoms, including in older adults. Both aerobic exercises, resistance training help. Think of exercise not as a fitness only, but as a nervous system regulator. Medication. On the pharmacological side, SSRIs and SNRIs remain first-line treatments. Pooled data consistently show medication like escitalopram and duloxetine outperform placebo for generalized anxiety disorder. Now, what about benzodiazepines? They do work quickly and sometimes they're life-saving for acute crisis, but the FDA has issued a boxed warning. The risk of dependence and withdrawal are serious. So we use them with caution and always plan for tapering. Supplements and lifestyle. There's growing interest in micronutrients and adaptogens, magnesium, omega-3 fatty acids, ashwagandha. Sleep hygiene, diet, and mindfulness are all foundational. They don't replace therapy or medication, but they create the baseline stability the nervous system needs to heal. So here's the takeaway. We already have effective evidence-based tools. CBT, exercise, SSRIs, they work. But here's the reality. Not everyone responds. Some don't. Some can't tolerate side effects. Some feel better short term, but the anxiety creeps back. And that's why researchers are pushing boundaries, mapping brain circuits, testing sound waves, exploring psychedelics. And this is where things get exciting. And honestly, some of these therapies sound like science fiction, but the science fiction is already here. Let's explore them together. One of the most fascinating discoveries came from Will Cornell researchers. They used something called photoprojection targeted photopharmacology. What that means in simple terms is using light to control very specific brain circuits. In animal models, scientists could activate a receptor in the amygdala pathways. The amygdala is the brain's alarm system, the part that screams danger. By activating this receptor, they literally turned down the volume of anxiety without triggering the side effects you see when medication floods the entire brain. Now, this is still preclinical. We're not putting lasers in people's heads tomorrow. But the principle is groundbreaking. Instead of a pill that affects the whole system, imagine a therapy that calms just the overactive circuit driving your anxiety. It's precision psychiatry. And even if we're years away from using this in clinics, it tells us something crucial. Anxiety isn't vague, it's circuit we can map and one day calm directly. Another one is quieting anxiety with sound, focused ultrasound. That feels futuristic. Researchers have tested MRI guided ultrasound, essentially sound waves targeted deep into the brain, and found it can calm emotional centers like the amygdala and cingulate cortex. In early pilot studies, patients with depression, anxiety, even PTSD showed way less symptoms without a single pill. Think of it as non-invasive neuromodulation. No surgery, no medication, just sound waves tuning the circuits that are too loud. We're still early. This is in trials, not clinics, but the principle is extraordinary. In the future, treating anxiety might feel more like a 30-minute sound therapy session than a prescription. We've all heard gut feeling, but now science is showing your gut literally talks to your brain. Recent studies highlight how microbiome-derived molecules like indoles regulate circuits linked to anxiety. In other words, the bacteria in your gut can either calm or stir up your nervous system. That opens a fascinating door, probiotics and diet as tools for anxiety. We're not fully there yet. The science is still growing, but imagine using food or targeted probiotics to dial anxiety down. So, the next time you think nutrition is just about digestion, remember your gut microbiomes may be whispering to your anxiety circuits. Here's one that excites me as both a psychiatrist and a fan of mind body medicine. At the Salk Institute, researchers identified the brain area responsible for why slow, deliberate breathing makes us feel calm. They found that neural pathway that connects controlled breathing to reduced anxiety and negative emotions. Why is this exciting? Because one day a medication can target the pathway, essentially giving you the same calm as yoga breathing, but in pill form. It's still 10 years away, but the discovery validates something important. When you breathe slowly and mindfully, you are literally activating a circuit designed to calm your brain. So until the pill arrives, every breath exercise you do is working on that exact biology. Another one is listening to your heartbeat. Now let's move from high tech to low tech, but equally powerful. Interoception is the ability to sense your internal body signals, like your heartbeat. In one study, participants trained to accurately notice their heartbeat experienced reductions in anxiety that lasted up to a year in 1/3 of them. Think about that. Not a pill, not a surgery. Just learning to listen to your own body's signals. Interception training is already being explored with apps, biofeedback, and mindfulness techniques. And finally, psychedelics. You've probably seen the headlines around psilocybin and MDMA, but here's something specific to anxiety. LSD-based therapy, known as MM120, is now in phase 3 clinical trials for generalized anxiety disorder. It already has FDA breakthrough therapy designation, which means regulators see it as promising enough to speed up development. Of course, this is still experimental. Psychedelics are not for everyone, and they must be done with careful medical supervision. But the fact that LSD, once taboo, is now moving through rigorous trials shows how far we've come in expanding the toolkit against anxiety. So, from light controlled brain circuits to ultrasound gut microbes, breath pathways, interoception, and even psychedelics anxiety research is exploding with innovation. But here's the key. When many of these are on the horizon, you don't have to wait for them. In the next chapter, we'll explore what you can already do today to train your nervous system, calm your anxiety, and start building resilience right now. So, we've seen what the future might hold. Photopharmacology, ultrasound, psychedelics. Fascinating, right? But here's the reality. Most of these therapies are years away from daily clinical use. That doesn't mean you're powerless until then. The same biology those researchers are targeting, your circuits, your serotonin, your vagus nerve, your interoception, can be trained today through lifestyle supplements and body-based practices. Let's explore what you can start with right now. You remember how researchers at the Salk Institute found the brain circuits that link slow breathing to reduced anxiety? That means every time you do mindful breathing, you're literally switching on that circuit. Practical tool: try coherent breathing. Inhale for 5 seconds, exhale for 5 seconds, about 6 breaths per minute. Just 5 minutes a day can calm the nervous system and lower anxiety. It sounds simple, but the science proves you are engaging the very pathway that future medications would try to mimic. Remember the study where people trained to sense their heartbeat more accurately, and 1/3 had reduced anxiety for an entire year? Here's how you can practice interoception at home. Sit quietly and place a hand on your chest. Close your eyes and try to feel your heartbeat without touching your pulse. Time yourself for 30 seconds, then check your actual pulse. Over time, this builds awareness of your inner signals. And when you can read your body better, you can regulate emotions more effectively. It's a skill, not a pill, but studies show it sticks. Anxiety is not just in the mind, it's embodied. Exercise meta-analyses show both aerobic and resistance training significantly reduce anxiety. Even 20 minutes of brisk walking changes brain chemistry. Sleep. Poor sleep worsens anxiety dramatically. Think of sleep as your nightly reset button for the nervous system. Simple steps like regular bedtimes, limiting screens, and creating a calm evening ritual are underrated, but clinically powerful. So here's the point. The futuristic therapies we discussed may take years to reach clinics, but the biology they target, vagus nerve, interoception, gut brain, serotonin, you can already influence today. Breathing, body awareness, gut health, movement, supplements, sleep. These are not small lifestyle tips. They are your current day circuit training for the anxious brain. Why therapies sometimes don't work instantly. Before we wrap up, I want to address something I hear all the time. I tried medication, I tried supplements, but I still feel anxious. Does that mean nothing will work for me? The answer is no. It means anxiety treatment isn't a switch, it's a process. Here's why treatments sometimes don't work instantly. For example, brain plasticity takes time. Circuits need repeated training, whether through cognitive behavioral therapy or interoception or exercise. Medication is trial and error. One SSRI might not help, but another class might. That's not failure, that's biology variability. Lifestyle is cumulative. Sleep, nutrition, supplements don't show up as a wow overnight. They build resilience slowly, like compounding interest. Science is still evolving. Some of the therapies we explore today, ultrasound, psychedelics, probiotics, are still on the horizon. If you don't feel better yet, it might simply mean you don't have the perfect tool yet. Anxiety is not a life sentence. The future of anxiety treatment is full of hope. Precision, brain circuits, sound-based therapies, microbiome science, psychedelics, and clinical trials. And right now, you already have tools at your disposal: breathing, interoception, movement, sleep, supplements that engage the same biology researchers are mapping. You are not powerless. You are training your brain, your gut, your nervous system with every small step. Anxiety doesn't vanish overnight, but every time you breathe slowly, every time you move, every time you choose rest, you're sending a signal to your brain: I am safe. And there's one more thing I want to add, something many people try to avoid. Sometimes, in our rush to fix anxiety, we throw tools at it like shields: breathing, supplements, meditation, therapy, all of those help. But sometimes anxiety is not something to avoid, it's something to feel. If it's there, it has a purpose. Anxiety is your body saying, pay attention. It's life moving through you. And sometimes the most healing act is giving yourself the permission to feel it, to let the discomfort exit without judgment, to sit with it, breathe with it, and ask, what is this trying to tell me? Tools are valuable, but the deeper transformation happens when you learn to hold space for your anxiety, not just fight it. To recognize, if it's here, it matters. If it's here, it's life. And if it's life, I can trust myself to be with it. If this video opened your eyes to what's possible, here's what you can do. Subscribe to this channel. Each week I share tools, insights, and new research so you can go beyond psychiatry and take charge of your mental health. Join my newsletter. I'll send you deeper exercise and resources I can't fit into a single video. Share this video with someone you know who struggles with anxiety. Sometimes the most healing thing is realizing you're not alone and that science is moving forward every day. You don't have to wait for a miracle cure. The future of anxiety treatment is bright, yes, but you already have the tools to start today. Every breath, every heartbeat you listen to, every step you take toward caring for your body and mind, it all matters. And if you keep going slowly, consistently, anxiety no longer controls your life. You do.